All right, so get this. You know how we're always told to read those tiny print medication side effects?
Yeah.
Well, some everyday medications, like those heartburn pills or even antibiotics,
Oh.
might have a surprising connection to depression.
Huh.
Now, before you raid your medicine cabinet, let's bring in expert speaker to help us understand what's going on here.
Yeah, it's important to remember that diagnosing depression isn't straightforward,
Right?
and we're definitely not offering medical advice today.
Of course.
Our goal is to explore these possible connections between common medications and your mood.
Yeah, I think this is going to be an eye-opener for a lot of our listeners.
I think so too.
We'll be covering medications like proton pump inhibitors.
Okay.
You might know them as PPIs, antibiotics, anti-seizure meds, and even steroids. So if you or someone you know uses these regularly, this deep dive is for you.
Every medication comes with potential side effects.
Yeah.
And it's always a balancing act between the benefits and the risks.
For sure. For sure.
Yeah. Okay, so let's start with those PPIs.
Okay.
I'm betting most people have taken an antacid at some point for heartburn.
Oh, yeah.
Millions of us rely on them.
Uh-huh.
And we're talking about medications with familiar names like omeprazole or lansoprazole.
Right.
Just to give you a sense of scale, in England alone, there were over 74 million prescriptions for PPIs written in 2023.
That's a massive number.
Wow.
And it shows just how common these medications are.
Yeah.
PPIs are highly effective at reducing stomach acid. But here's where things get interesting.
Okay.
They can also affect how well your body absorbs vitamin B12.
So what happens when our bodies don't get enough B12?
Well, B12 is absolutely essential for our nervous systems to function properly.
Okay.
A deficiency can show up in all sorts of ways, and some of them might surprise you.
Okay.
The NHS lists symptoms that range from, yes, mild depression and anxiety to more serious issues like confusion and even dementia.
Hold on. So those symptoms, memory problems, confusion, even depression.
Right. Those are listed as potential side effects on PPI information leaflets, too.
Yeah.
It's almost like a hidden warning in plain sight.
It really emphasizes why it's so important to carefully read those leaflets and talk to your doctor if you have any concerns.
Absolutely. Okay, so back to B12. How does a lack of it tie into mood specifically?
This is where it gets fascinating.
Okay.
B12 actually plays a role in the production of serotonin, a key neurotransmitter that regulates mood.
Okay.
In fact, there was a small study back in 2017 that found a potential link between PPI use and depression in elderly patients.
Okay.
Around 1 in 6 cases of depression in that group could be traced back to PPI use.
That's pretty significant, even if it was a small study. And it makes you think, especially when you consider what one pharmacist told us, PPIs hindering nutrient absorption could directly impact serotonin production.
Right. It's a complex interplay of factors, and definitely more research is needed to fully understand the implications.
Yeah.
But it raises important questions about the long-term use of PPIs.
Okay. Moving on from the potential impact of PPIs, let's talk about another common medication. Antibiotics.
Okay.
I think most of us view antibiotics as a short-term solution, a quick fix for infections,
Right.
without giving much thought to long-term effects.
Yeah.
But it seems they might have some unintended consequences, too.
You've hit a crucial point there.
Okay.
Antibiotics can be lifesavers, but there's often a trade-off.
Right.
We're focusing specifically on a class called fluoroquinolones.
Okay.
Levofloxacin and ciprofloxacin are two you've probably heard of.
And how do these antibiotics, which we use to fight off infections, potentially affect mood?
Well, research has shown that fluoroquinolones can disrupt the balance of bacteria in your gut, something we call the gut microbiome.
The gut microbiome, we hear so much about it these days.
We do?
Can you remind us why it's so important, especially when it comes to mood?
Absolutely.
Okay.
Your gut is home to trillions of bacteria, and we're learning more and more about how vital they are to your overall health, including your mental well-being.
Okay.
These bacteria actually influence the production of hormones in your brain that directly affect mood.
So when antibiotics come in and wipe out both good and bad bacteria, it's like throwing a wrench in the works of our internal system.
Exactly. This disruption can have a cascade of effects.
Wow.
Potentially leading to changes in mood and even increasing the risk of depression.
Okay.
In fact, the NHS lists low mood as a possible side effect of ciprofloxacin, affecting roughly 1 in every 100 people taking it.
Wow, I had no idea it was that common.
Yep.
I've heard that some people are advised to take probiotics after a course of antibiotics to help restore their gut health.
Right.
Could that potentially help with these mood-related side effects as well?
That's a great question.
Yeah.
Probiotics are live bacteria and yeast that are beneficial to your health, especially your digestive system. They can help repopulate the gut with good bacteria. However, more research is needed to say for sure if they can counteract mood-related side effects from antibiotics.
Okay, so it seems like we're just starting to scratch the surface of how intricately connected our bodies are.
Yeah.
Moving on from the gut's impact, let's talk about medications that directly affect brain activity.
Okay.
Like anti-seizure medications. I know some of these are prescribed for other conditions like nerve pain too.
That's right.
Okay.
Medications like topiramate,
Okay.
which goes by the brand name Topomax, and gabapentin or Neurontin are quite commonly prescribed. We're talking an estimated 700,000 prescriptions written every month.
So these medications are designed to calm overactive brain activity.
Yeah.
Does that mean they could inadvertently flatten mood as well?
That's the concern.
Okay.
These drugs work by suppressing electrical activity in the brain, which is effective for controlling seizures, but can also have unintended consequences for mood.
It makes sense, right? If they're affecting brain activity, it's not surprising that mood could be impacted.
Exactly. And studies suggest that about 1 in every 100 people taking these medications experience mood changes or even depression.
It's a good reminder that even medications that are meant to help us can sometimes have unexpected drawbacks.
Definitely.
Okay, on to our last category for this part of our deep dive. Steroids.
Oh,
These are used for so many things, from asthma to arthritis.
you're absolutely right.
Yeah.
Steroids, also known as corticosteroids, are powerful anti-inflammatories prescribed for a wide range of conditions.
Okay.
In England, there are about 70,000 prescriptions for steroids written each month.
They're obviously very effective at reducing inflammation.
Yeah.
How does that link to depression, though?
Well, while suppressing the immune system and reducing inflammation is beneficial for treating many conditions, it can also interfere with the delicate balance of hormones and neurotransmitters in the brain that are involved in regulating mood.
So by calming down inflammation, steroids might also be unintentionally affecting the brain's ability to manage stress and emotions.
That's one of the key takeaways here.
Okay.
This potential disruption in the brain's stress response can show up as various psychiatric side effects, including depression. Some studies suggest that the risk of experiencing severe psychiatric issues from steroid medications could be as high as 1 in 20.
1 in 20. That's a significant number.
It is.
It really makes you think twice about the medications you're taking.
It's important to remember that the risk varies depending on the dosage and individual factors.
Right.
However, the NHS advises that mental health problems are more likely to occur with prolonged steroid use,
Okay.
typically for periods longer than 3 weeks.
So it's not just the type of medication, but also how long you're taking it that can factor into these potential side effects.
Precisely. It's all about being informed and having open communication with your doctor.
I think you've given our listeners a lot to think about.
I hope so.
Let's take a moment to digest this information and come back to discuss some specific examples and potential solutions in the next part of our deep dive.
Sounds good. All right, so we've laid out some of the potential connections between common medications and mood changes.
Right.
Now let's ground this with some real-life scenarios to help illustrate what this might look like for you.
Yes, let's get specific.
Okay.
It helps to see how this plays out in someone's everyday life.
Exactly.
Yeah.
Let's go back to PPIs for a moment.
Okay.
Imagine someone who's dealing with chronic heartburn, relying on those daily PPIs to get relief.
Yeah.
Over time, they start noticing they're more tired than usual,
Okay.
having trouble concentrating and just feeling a bit down.
Yeah.
They might even chalk it up to stress,
Yeah.
or just getting older, not realizing it, could be tied to their medication.
That's a great example of why understanding these potential side effects is so important.
Yeah.
It's easy to dismiss those subtle changes when you don't know what to look for.
Right.
So what would you recommend someone in that situation do?
The first step is always to talk to their doctor.
Okay.
A simple blood test can check for B12 deficiency. And if that's the culprit,
Right.
B12 supplements could be a game changer.
It seems straightforward, but I bet it's something people might overlook.
Yeah, it's easy to forget about the simple things.
Okay, let's shift gears to antibiotics.
Okay,
It's easy to think of them as a quick fix.
Right.
You take them for a week or so and then you're done right.
right.
But as we talked about, even short-term use can affect the gut microbiome.
Right, think about someone who takes a course of ciprofloxacin for a urinary tract infection.
Okay.
They kick the infection,
Mm-hmm.
but then in the weeks that follow,
Okay.
they find themselves feeling more irritable, anxious, or just generally low.
Okay.
They might not connect the dots back to those antibiotics they took a while ago.
It's like a delayed reaction.
Yeah.
I'm curious, when doctors are prescribing antibiotics, are these potential mood-related side effects something they routinely consider?
That's a great question.
Yeah.
And it brings up the need for more awareness and education for both healthcare providers and patients.
Right.
While antibiotics are essential for fighting bacterial infections,
Right.
it's crucial to weigh the benefits against the risks
Yeah.
and consider the individual patient's medical history
Okay.
and how sensitive they might be to side effects.
So it sounds like a one-size-fits-all approach isn't ideal.
Yeah, you're absolutely right.
Okay, speaking of personalized care, let's talk about anti-seizure medications.
Okay.
These are often used for conditions where brain activity is already a factor.
Right.
So I imagine extra caution is needed.
Absolutely.
Okay.
Take, for example, someone with epilepsy who's been taking to Boremids to manage their seizures.
Mm-hmm.
They found a dosage that works for them.
Okay.
But then they start to notice subtle shifts in their mood.
Okay.
Maybe they're withdrawing socially, losing interest in things they used to enjoy, or just feeling a sense of apathy. These changes might be gradual, but over time they can have a big impact on their quality of life.
It's a reminder that medications, even when they're helping in one way,
Yeah.
can have unforeseen effects in other areas.
That's why open communication with your doctor is so vital
Right.
if you're on any medication,
Yeah.
especially one that affects the brain.
Okay.
And you notice changes in your mood or behavior,
Right.
don't hesitate to reach out to your healthcare provider.
Better to be safe than sorry. Absolutely. Okay, let's wrap up this section with steroids.
Okay.
They're often prescribed for short periods,
Yeah.
but as we discussed, even that can have an impact.
Here's a scenario.
Okay.
Someone has a severe allergic reaction and is given a short course of prednisone to bring down the inflammation and get some relief.
Right.
The medication works for the allergy,
Okay.
but during that short time they're taking it, they experience wild mood swings,
Wow.
become easily agitated,
Okay.
and even have trouble sleeping. These symptoms might go away once they stop the steroids, but it can be a pretty unsettling experience.
Especially on top of the stress of dealing with the allergic reaction in the first place.
Exactly.
Yeah. Hey.
Steroids, while important for certain conditions,
Yeah.
have a powerful impact on the body, including the brain.
Right.
It's about using them carefully
Yeah.
and being aware of the potential downsides.
It feels like the recurring theme here is awareness.
Yeah.
Knowing what the potential side effects are, paying attention to how your body is reacting, and talking to your doctor about any concerns.
You've hit the nail on the head. Knowledge is power when it comes to your health.
Okay, so let's say someone is listening to this and thinking, wow, this is all a bit overwhelming.
Yeah, I can see that.
What practical advice would you give them to be more informed and proactive?
That's a great question.
Yeah.
First off, don't be shy about asking questions.
Okay.
When your doctor prescribes a medication, make sure you understand why you're taking it, how it works, and what side effects to watch for.
Don't just passively take that little slip of paper without really understanding what it means for you.
Right.
Yeah.
And those medication leaflets, actually read them.
Oh, yeah.
They're full of important information about side effects,
Right.
interactions with other drugs, and precautions.
Okay.
Highlight anything that worries you.
Yeah.
Make notes and discuss it with your doctor or pharmacist.
And if you notice any changes in your mood or behavior while on a medication, speak up.
Yeah, exactly.
It's always better to address things sooner rather than later.
Absolutely. And remember, you're not alone in this. There are lots of resources to help you navigate this.
Okay.
Talk to your pharmacist. Check out reputable websites like the NHS website.
Right.
And think about joining support groups or online forums where you can connect with others who might be going through similar experiences.
It's a good reminder that being your own health advocate is crucial. Now, we spent a lot of time talking about the problems.
Yeah.
Let's end this part on a more positive note.
Okay.
What are some things people can do to mitigate these risks and take control of their well-being?
That's a great point.
Yeah.
It's not all doom and gloom.
Right.
There are proactive steps you can take to minimize the risk of medication-induced depression and really look after your overall well-being.
Let's hear some of those positive steps.
I'm happy to share. It might sound simple,
Okay.
but prioritize those lifestyle factors that support mental health.
Okay.
Make sure you're getting enough sleep, eating a balanced diet, getting regular exercise, and incorporating stress-reducing activities like yoga or meditation into your routine.
It's classic advice, but for a good reason.
Yeah.
Those things really do make a difference.
They really do.
Yeah.
They can have a huge impact on your mood and resilience, which helps you better manage any potential side effects from medications.
Okay, that's great.
Also, if you're concerned about medication-induced depression, talk to your doctor about alternative treatment options.
So there might be other medications that can treat the condition without the same risk of mood-related side effects.
Exactly.
Okay.
Or, depending on the situation,
Right.
non-medication approaches like therapy or
Yeah.
lifestyle modifications might be more appropriate.
Okay.
It's about finding the best solution for you,
Yeah.
not just following a standard protocol.
It's all about that personalized approach.
Exactly.
This has been incredibly insightful.
Glad to hear it.
But I feel like we've only just scratched the surface of this complex topic.
You're right. There's so much more to explore, and research is constantly shedding new light on the connections between medications, the gut microbiome, and mental health.
It feels like we're at a turning point in understanding how all these systems work together.
I agree. Every day we're gaining more knowledge,
Right.
which helps us make more informed decisions about our health.
Now we've covered a lot of ground, but there's more to come. We'll be back after a short break to discuss some broader implications of what we've learned and talk about what the future might hold for personalized medicine and mental well-being. So we've covered a lot of ground in this deep dive exploring how common medications could be linked to depression.
We have.
It certainly made me think differently about what's in my own medicine cabinet.
It's a complex topic.
Yeah.
And what's fascinating is we're really just starting to understand these connections.
Right.
The more we learn about the gut microbiome, for example, the more we realize how deeply it impacts our overall health,
Right.
including our mental well-being.
It's amazing to think about this whole hidden world within us
It is.
that plays such a crucial role, but it also makes you wonder if these medications are so widely used and can potentially disrupt the gut microbiome, what are the long-term implications for our collective health?
That's a question worth pondering. It's not about vilifying medication. It's essential for treating countless conditions and saving lives.
Of course.
But this deep dive underscores the need for a more holistic approach to healthcare, one that recognizes how interconnected our bodies are and acknowledges the possibility of unintended consequences.
It's about understanding that every action can have a ripple effect.
Exactly. And this leads us to the exciting potential of personalized medicine.
Okay.
Not everyone will experience these mood-related side effects.
Right.
And how individuals respond to medication can vary greatly.
So how do we move towards this more personalized approach?
Well,
what needs to change in healthcare to make that happen?
I think it starts with awareness, both on the part of healthcare providers and patients. Doctors need to be more aware of the potential for medication-induced depression and consider alternative treatment options when appropriate.
Right.
And patients need to feel empowered to ask questions.
Yeah.
Advocate for their own health.
Right.
And report any unusual changes they experience while taking medication.
It's a partnership, a two-way street between doctor and patient.
Absolutely. And technology is going to play a key role in this shift.
Okay.
As we develop more sophisticated tools to analyze individual genetic profiles, gut microbiome compositions, and other biomarkers, we'll be able to better predict who's most susceptible to certain side effects and tailor treatment plans accordingly.
So we're looking toward a future where medication is truly personalized. Minimizing risks and maximizing benefits.
That's the goal. And it's not just about treating diseases. It's about optimizing well-being.
Okay.
The more we understand these intricate interactions within our bodies, the better choices we can make to support both our physical and mental health.
It feels like we're on the cusp of a new era in healthcare.
I think we are.
One that's more holistic, personalized, and proactive.
The possibilities are incredibly exciting.
Well, on that optimistic note, I think we've reached the end of our deep dive for today. But the conversation doesn't end here. We encourage you to continue exploring these topics. Ask questions. Share your experiences.
For sure.
And be an active participant in your own health journey.
Knowledge is power. And the more we understand about how our bodies work, the better equipped we are to make choices that support our overall well-being.
Thank you for joining us for this deep dive into the hidden world of medication and its potential impact on mood. We'll see you next time for another fascinating exploration into the world of knowledge.